Hello, everyone. Today we're going to dive into one of the most important yet often overlooked organs in the human body, the kidneys. They may only be the size of your fist, but they play a huge role in keeping your body balanced and healthy. By the end of this presentation, you'll understand what the kidneys do, what happens when they stop working properly, and why chronic kidney disease is such a serious condition. The kidneys are bean shaped organs located at the back of your abdomen, just beneath your rib cage. Most people have two kidneys, but some are only born with one kidney. And the kidneys are part of the urinary system. Each kidney contains about 1 million microscopic filters called nephrons, which filter waste products and excess fluid from the blood. Think of your kidneys like a natural water filter system. They clean and recycle what your body needs while getting rid of the trash. Without the kidneys, waste and toxins would quickly build up, making us very sick and can even cause death. The kidneys do more than just make urine. They filter toxins and waste from the blood. They balance the body's pH so your blood doesn't become too acidic or too alkaline. When your blood sugar is low, the kidneys can actually produce glucose to keep the body supplied with energy. They also release hormones like erythropoietin, which tells the bone marrow to make more red blood cells. On top of all of this, the kidneys help regulate blood pressure and keep electrolytes like sodium and potassium balanced. In short, the kidneys are small, but they are powerhouses. Now, let's talk about what happens when the kidneys stop working properly. Chronic kidney disease, better known as CKD, is when the kidneys slowly lose their function over time. Unlike a sudden kidney injury, this decline happens gradually and can go unnoticed in the early stages. By the time symptoms appear, kidney damage is often advanced. CKD affects millions of people worldwide and is a leading cause of a serious health problem like heart disease and premature death. Your healthcare provider usually measures CKD with a test called GFR. That's a fancy term for how much blood your kidneys can clean each minute. A healthy kidney cleans at a GFR rate of 90 or more. As the number drops, your kidneys are struggling. By the time you reach stage 5, your GFR is below 15. Basically, the kidneys are no longer able to keep you alive without dialysis or kidney transplant. The tricky part, most people don't even realize they have CKD until they're in about stage 3 or beyond. And that's when real symptoms start showing up. So, why do the kidneys break down? Diabetes can be a factor. High blood sugar acts like sandpaper on those tiny kidney filters. Over time, they get scarred and clogged, and the kidneys can't keep up. That's why diabetes is the number one cause of kidney failure. Next, high blood pressure can be a factor. Think about turning a garden hose on full blast for years. The constant pressure damages the delicate blood vessels in the kidneys. It's not just strain, it's long term wear and tear that weakens their function. Also, kidney infections. Each infection leaves scars. A few might not matter, but repeated kidney infections are like potholes in a road. Eventually, the whole system breaks down. You also, kidney stones, they don't just hurt, they block urine flow. Repeated stones can damage tissue and increase the risk of infections, adding even more stress to the kidneys. And here's the bigger picture, our lifestyle plays a huge role. A diet loaded with processed foods, salt, and sugar keep kidneys working overtime until they're simply worn out. When your kidneys start failing, your body lets you know. Um, Patients will usually experience swelling in their feet, their ankles, and sometimes around their eyes. Um, the feelings, symptoms of fatigue. You feel drained no matter how much you rest. Your urine changes, it becomes foamy, dark, or less output. Then you have nausea and vomiting. As the toxins are building up, you will experience these symptoms. Also, muscle cramps and itchy skin from the imbalances in minerals. These are not random, they're the body red flags waving hard. CKD, also known as chronic kidney disease, has 5 stages. And here's what it looks like. Stage 1 is called the silent damage. The kidneys are hurt, but they're still working fine. You don't experience any symptoms. It's like a crack in the windshield. Stage 2, this is the early decline stage. Function drops a little, maybe slight swelling or more night bathroom trips. Most people still feel normal around this stage. And then we have stage 3. This is the wake up call. Function is down to half power. Fatigue, swelling, and urine changes appear. This is where most people finally find out something's wrong. And then we have stage 4. This is severe damage. Symptoms that cannot be ignored, such as nausea, itchy skin for no apparent reason, shortness of breath. Your healthcare provider usually will start preparing you for dialysis or a kidney transplant. And then we have stage 5. This is called end stage renal disease. The kidneys have failed. Without dialysis or a transplant, your survival is not possible. This is why catching CKD early makes all the difference. Here's the truth: without God's healing, there's no permanent cure for CKD, but we can slow it down. That means controlling blood pressure and your blood sugar, eating a kidney friendly diet, less salt, less junk, more balance. Avoiding medications that strain the kidneys, such as Aleve, Advil, ibuprofen, aspirin. Um, these are called NSAIDs, and they can actually cause more strain on the kidneys. Also, stand on top of your regular healthcare provider checkups. And if things reach stage 5, dialysis and transplant step in to save lives. So here's the takeaway: your kidneys are small, but they're mighty. They don't complain until they're in trouble. But by then, the damage is serious. Take care of them now, and they'll keep you going strong. Think of your kidneys like that one loyal friend, the one who always cleans up after the party while everyone else is asleep. They never ask for thanks, but if they stop showing up, whoa, you're in trouble. So don't take them for granted. Thank you for tuning in. If this has helped you, hit the like button, share it with a friend, and subscribe for more health talk made simple. And don't forget, drop your questions in the comments below. Let's keep the conversations going.